Pulmonary embolism. Pulmonary embolism is the sudden blockage of a major blood vessel in the lung, usually by a blood clot that travels to the lungs from the legs or rarely other parts of the body. If the blood clot block blood flow to the lungs, pulmonary embolism can be life-threatening, especially if a clot is large or if there are many clots. It can damage part of the lung due to restricted blood flow, decrease oxygen levels in the blood, and affect the other organs in the body. Sometimes it's possible that anything that gets in the bloodstream and then lodges in the smaller pulmonary arteries can be a pulmonary embolism. For example, fat from the marrow of a broken bone, air bubbles, or a part of a tumor or other tissue. And in a very rare cases, during delivery or immediately after the baby is born, amniotic fluid that surrounds the baby gets in the mother's bloodstream and travels to the lungs, causing pulmonary embolism. Causes. The cause is usually a blood clot in the leg called a deep vein thrombosis that breaks loose and travels through the bloodstream to the lung. Blood clots can form for a variety of reasons. Anyone can get a pulmonary embolism, but certain things can raise the risk of pulmonary embolism. Major surgery, medical conditions, including cancers, heart diseases, lung diseases, taking birth control pills or hormone replacement therapy, pregnancy, family history, and genetic blood clotting disorders. Fractures of the leg or hip, age, especially if you are older than 70, extreme overweight, smoking, prolonged immobility, or being inactive for long periods. Symptoms. Half the people who have pulmonary embolism have no symptoms. The most common symptom of a pulmonary embolism is sudden shortness of breath. Other symptoms of pulmonary embolism include sudden sharp chest pain that may become worse with deep breathing or coughing, anxiety, bloody cough or spitting up blood, fainting, heart palpitations, leg pain or swelling, discolored skin, excessive sweating, rapid or irregular heartbeat, lightheadedness or dizziness. Pulmonary embolism can be life-threatening. Seek immediate medical attention if you experience unexplained shortness of breath, chest pain, or a cough that produces bloody sputum. Diagnosis. Pulmonary embolism may be hard to diagnose because its symptoms may occur with or are similar to other conditions such as a heart attack, asthma, a panic attack, or pneumonia. Also, some people with pulmonary embolism don't have symptoms. To make a diagnosis, your healthcare provider will typically perform one or more of the following tests to discover the cause of your symptoms. Tests may include blood tests, chest x-ray, electrocardiography, MRI, CT scan, pulmonary angiography, duplex venous ultrasound, and venography. Treatment. Treatment for a pulmonary embolism depends on the size and location of the blood clot. If the problem is minor and caught early, doctor may recommend medication as treatment. Some drugs can break up small clots, which include anticoagulants or blood thinners. Drugs such as heparin and warfarin prevent blood clots from getting larger and stop new clots from forming. Blood thinners can help reduce your risk, but they increase your risk of bleeding. If your doctor prescribes blood thinners, be sure you understand how to take your medicines safely. Thrombolytics. These medicines dissolve clots quickly, but they increase the risk of bleeding, hence they are used only in case of life-threatening conditions. Surgery. Catheter-assisted thrombus removal uses a flexible tube to reach a blood clot in the lung. Healthcare provider can insert a tool in the tube to break up the clot or to deliver medicine through the tube. Vein filter. Vein filter may be used in some people who cannot take blood thinners. Doctors will make a small incision, then inserts a filter inside a large vein called the vena cava that carries blood from the lower body to the heart. The filter prevents blood clots from traveling from legs to the lungs. After receiving proper treatment for a pulmonary embolism at the hospital, doctor will advise to take anticoagulant medications to prevent blood clots from returning. It's also necessary to use compression stockings to prevent clots from forming in the legs. Regularly exercising of legs is a key component of therapy after a pulmonary embolism. Prevention. Measures to prevent pulmonary embolism include move more, take walks daily to improve blood flow. Shorter, frequent walks are better than one longer walk. If you have had surgery or have been on bed rest for other reasons, try to get moving as soon as possible. Take a break from sitting. While sitting, don't cross your legs, which can impede blood flow. Get up and walk around every hour or so, or flex your feet often. Avoid sitting for long periods. Wear compression stockings if you are at high risk. There are different types, so it's best to use the kind that your doctor recommends. Wear them every day while you are awake, especially while you are on your feet, which help improve blood flow, avoid fluid from pooling in the legs, and relieve symptoms caused by varicose veins and deep vein thrombosis. They offer a safe, simple, and inexpensive way to keep blood from stagnating during and after general surgery. Exercise. Regular exercise lowers your risk of blood clots, which is especially important for people who sit a lot or travel frequently. Keep your leg elevated. Blood can pool if your feet are on the ground all day, so use a stool or chair to keep your legs elevated or stretch your legs and feet while sitting. Elevating your legs during the night can be very effective. You can lower your risk of blood clots by healthy lifestyle changes such as eating healthy diet, drinking plenty of water, quitting smoking, avoiding alcohol, losing weight, keeping blood pressure under control, and avoiding wearing tight clothes. Thank you.